I'm Dr. Gilma Bodley, and welcome to Doc Says, a health mini-series by the BVI Health Services Authority. In a few minutes, we'll explore health topics that matter to you, answer your questions, and share real, reliable advice to support your well-being. Today, we're talking about medication compliance and what it means and why it's so important. Today, joining us is Dr. Jamal Wintz. He's our clinical and informatics pharmacist here at BVIHSA. Welcome. Thank you so much for coming on the show.
Not a problem. I'm happy to be here.
So let's jump right in.
Okay.
What is medication compliance?
That's a simple thing. Well, simple for me. Fancy term, but essentially it's just taking, in medicine we have something we call the 5 rights. But the most important things is taking the medication at the right time, at the right dose, and essentially how the doctor wanted you to take it, whether it's in the morning or the evening or 3 times per day. Just making sure that you're taking the medication the way that it was prescribed.
All right. So in our last episode, we talked about the Red Loud campaign, which is still going on, and we wanted to keep going. Dr. Samuel mentioned that sometimes overuse of medication can put a patient into kidney failure. But the opposite can also be true, whereas if you're not compliant with your medication to control specifically, like let's say diabetes or high blood pressure, that can also send you into kidney failure.
Right.
There's obviously a delicate balance that needs to be struck. So can we talk about therapeutic dosing and like how important that is?
Yeah, right. So what you're talking about is like a big fancy term again. Therapeutic index is what we use in medicine and pharmacy. But I'll try to simplify it for the audience. We all live in an island. What we see in medicine, it's a graph, like a wave, like that. But we're on an island. So I'll use the hill example. So essentially, where you want to be is where the hills are. So you want to be on top of the hill, and you don't want to be in road town. You don't want to be on flatland, because we have a maximum concentration or a maximum amount of drug that we want in your body. And then we have a lower half, so that's where road tongue is. So you kind of want to be in that sweet spot, as you mentioned, because if you go above the level of that hill, let's say you're into the sky, that's when, what Dr. Samuel mentioned, it could become a bit toxic. But if you don't take enough of your medication, you could be in road tongue on the flatland, and that's below our concentration that is effective for that patient. So essentially, if you take your medication consistently, you'll stay on that hill. Like you stay in that nice sweet spot that can get you what needs to be done, whether it is controlling your blood pressure or controlling your blood sugar, or I think even some individuals, when it comes to antibiotics, you want to make sure you're taking that consistently, because that's going to kill the germ that is within your body.
Right. So what I see a lot in my emergency room is there are patients who have seizure disorders or who have blood clots. These are common things these are common medications that patients have to take where you do need to have, it's important to have that sweet spot so they don't end up with clots or that they don't end up with seizures. And one of the things that most patients are kind of clever in telling you, you ask them, well, when last did you take your medication? I took it yesterday, or I took it today, because they know that they're either coming in to see us, they know that they're coming into the hospital, but have you been taking it every single day? Just because you took it yesterday or you took it this morning, it's not gonna snap and it's not gonna work their magic and automatically clear the blood clot.
Agreed. And also, one thing I think you do also in the ER is you take blood levels. And down in our lab, our team down in the lab, I would like to say to patients, you can't lie to us. Sometimes you can't cheat. That therapeutic index or that drug level that we spoke about before, we can look at that on a blood sample. So you take your blood. When you come into the ER, I said, hey doc, I'm not feeling well, or you experienced a seizure. We'll take that blood level, we'll take a look at it, and we'll look at the range, because a lot of the drugs have a range. Everyone's, depending on the drug, the hill looks different. So when you look at that, you can see, hey, well, you weren't taking the drug. So, but doc, I took the drug. But I'm like, well, we're looking at this And it takes some time because, as you mentioned, people think you take the medication and it works right away.
Yeah.
It takes some time to get to where you're needing to go. You can't get from Road Town to East End in 2 seconds. It takes at least 30 minutes to get to East End. You need to take some time to get there. And the same thing when it comes to our diabetes medications. I think some of the audience may know, if you're diabetic, about the A1C, which is a measure of your blood sugar, and that's over the course of 3 months. So when we take that, we also can see that you have not been taking your diabetes medication, because if you've been taking it consistently, most likely that number is going to be lower or within a range that your doctor finds as acceptable. So I say all that to say, you can't lie to us because we know.
Yeah, we always know.
Yeah.
Just one other point I'd like to drive home in terms of how important it is to take the medication consistently.
Right.
Or rather, you're the best person to ask this question. If you missed your medication for a day or two, how long, and therefore your levels would have dropped below therapeutic levels after a day or two, how long does it take to build back up in your system?
So that is going to change based on the drug.
So let's say
Yeah.
Keppra is this is a medication for seizures, for seizure disorders. So for our patients out there who have seizures, this is one of the most common drugs that they take. So let's take Keppra for instance.
Yeah, so that can take anywhere for probably 12 to 24 hours, but for some patients, because another thing that individuals may not know, me and you may be a bit healthier, but unfortunately some of the individuals that we have, they have kidney problems and they have liver problems, and those drugs have to be broken down by your kidneys or liver. So it may take even longer. So you may think, oh, well, my friend has this disease and they took the medication and it worked within a day and they're back to normal. But for you, we talked again about the dialysis patients or those patients that have kidney disease. It may take a bit longer for them to break that drug down. And I think people, one thing you also mentioned, we try to play catch up. They'll take a bunch of meds at once. And that's how you end up with that toxic bit, and that's where you come in the ER, because now we have a space where we overdose. So I say all of that to say that it could vary by patient, but yeah, anywhere 12, 24 hours depending on the drug, as you mentioned, Keppra, or as the patient as well. So it could vary.
All right. Yeah, I like to compare it. When I counsel my patients, I like to tell them, you can easily gain 5 pounds when you go on vacation for a week,
right,
and it takes a month
to lose
the weight.
Yeah.
If you're, a young 20-something-year-old, sure, you can probably lose that weight in a week or two.
Right.
But to a 50-year-old who is menopausal, a 50-year-old lady who's menopausal, that's going to take a couple months just to lose those same 5 pounds that you gained in a week.
Right.
So it's really important to be consistent and take your medication every day. So what suggestions would you have to encourage your patients to take their medications every day?
We are in it's 2025, I think. Yep. That's it. And a lot of our patients that we experience that don't take their medications on time, you think, oh, it's my grandmother or someone older. Well, they have to take meds, but we have a lot of young people. Again, that's what you guys mentioned last episode. You're techie. Like this, I brought this. This is very, very important. Yes. Especially with I use the iPhone, for example. They have a medications app, or in the health app, they have a medications function that you can use. You can put in your medications, and it can tell you what time that you need to take it. We have a reminder, like you have those apps like Siri or Google. You talk to them, it's like, hey, can you remind me to take my meds daily at this time? Or you put it in a reminder. There's so many things, and there's some old-fashioned things. Just take a pill box. You have your pill box. You put your meds in there, and there's a lot of apps online that can help you out with that. You can sit down and make a medication diary, and that's helpful for both you and your doctor, because you could indeed be taking your medications on time and it might not be working for you. And that's why it's important for you to be that engaged and that in tune to what you're taking and how you're taking it, because we can only see you for about 20, 30, 50 minutes at a time in the doctor's office. but you have to take charge of your health. And of course, having a chat with us, speaking to your pharmacist. It's like, hey, well, Dr. Wintz, I'm having challenges with taking this at a certain time. We can work alongside with you as well as your doctor, because honestly, the end goal, we want to make sure that you're taking the meds the way that you're supposed to. So let's say you're waking up at 6 a.m. and the drug is supposed to be taken, at 8 a.m. or 8, at lunchtime. We can kind of sit down and say, hey, walk me through your day.
Yes.
Is there something that we can do to change things up to ensure that the medication's working the way that it's supposed to? So have a conversation, use technology. You can use some old school methods, just writing things down on a paper. You could bring it to your doctor's appointment and you walk through it. Like, you show your calendars, like, these are the days that I took this. It really does come down to you taking charge of your health.
Yes. I think that's very, very excellent advice, particularly talking with your pharmacist. A lot of patients don't realize that, there's even a section in the pharmacy, in most pharmacies, where there's a section for counseling, or you have questions, and you can go there and have those discussions. And if there is a problem with timing of the dosing, you can always, the pharmacist can always give us a call. They have access to us. They can give us a call and say, listen, doc, this 3 times a day dosing thing, it's not working for them. It won't work with their schedule. Is there any other medication that you can give, or can we adjust the dose? Here is what I suggest. And that's what that communication is all about. The patient comes to one of us and we can have that discussion.
And that's important because, honestly, I think I can speak for both of us. We're human. We don't always get it right. We go according to what the individuals that make the drug and how it was studied. And that's how we usually prescribe it, but it's not a one-size-fits-all model.
Exactly.
So as much as possible, we want to ensure that the care that you're getting is surrounded around you. We just don't want to have a broad brush. Help us out. Help us to help you.
Yes.
Essentially. So, have a conversation with us. I mean, usually your pharmacist sometimes is a lot more accessible for you compared to a doctor and or nurse in our community clinics. You can just walk up to us, have a conversation, because sometimes we don't have an appointment. Like, you can just walk in, it's like, hey, I need to have a conversation with you. These are my challenges. Have a chat with us. I'm sure I can speak for most pharmacists in the country. They'll be willing to have that chat with you.
Yeah. Good. I'm really, really happy to hear that. It's really surprising as to how many people don't realize that they can, just freely chat with
Agreed.
any medical professional, whether it's a doctor, the nurse, or the pharmacist, or the community pharmacist. So that's really great.
We don't bite.
This next question is a topic all in itself, but it's something that I would really like to target at least a little bit in this episode. Antibiotics. A doctor's worst fear, cringe factor in a room sometimes, is when a patient will tell you, they say a mom comes in with their child and their child is sick, and they'll say, doc, I have some leftover antibiotics in the fridge that my older son had. And I saw that he had the same, my younger son now has the same symptoms. So I just started to give him that one. I mean, we stay professional. We keep our doctor poker face on and we listen very intently. But deep inside, we're just cringing like, no.
Yeah.
So can we talk about
antibiotics?
Yes, and how important it is to finish the dose.
Yeah.
Because patients will stop right when they feel better and not understanding why it's important.
So that really does go back to what we were speaking about before, about that therapeutic index. I mentioned antibiotics as an example. There's multiple bugs out there, lots of different bacteria out there that exist, and all of them behave a bit differently. And those antibiotics that you're taking, they behave a bit differently as well, because some of them work based on strength, we call it concentration, and some of them work based on duration, and that speaks to that therapeutic index. So you want to ensure, if the doctor says it's for 5 days, I know by day 2 or 3, some individuals are like, oh, I'm great, doc, I'm back on the mend. But when you stop that medication, what happens is something called resistance. Bacteria, they're smart. If you think you're smart as a human being, bacteria, it's been around as long as human beings have been around. They can think about, well, the next time this person experiences this infection, he's probably going to take this medication again. Let me figure out a way to prevent that from happening, because bacteria, they just want to survive just like us. So once you stop that medication, you build up resistance to that particular drug. Which is why it's important, because when you get to the hospital, let's say unfortunately something happens to you, and you get to the hospital and we're looking for an antibiotic to treat, let's say you got a cut, or some of our diabetic patients, they have diabetic foot infections. We don't have anything to give you because you've taken the medication, great, you left the hospital, you took it, but then you stopped it because it looks like my wound is fine. Then you stop, and then the bacteria is like, well, I'm sorry, I'm not going to help you this time. You didn't take the medication. So it's very, very important to take the medications until it's finished, and don't share it with your family members. Don't take it upon yourselves to say, well, this worked for me, it'll work for you, because they'll also be faced with the resistance that we're talking about. It is a challenge. I think if you look it up, it's probably one of the biggest health challenges that we're experiencing and we're going to experience for the next 10 years.
Yes.
All of these resistant bacteria, because unfortunately, we won't, if you continue to do this, we won't have anything to give you.
Yeah.
And that is, I think, something that keeps all of us up at night. We want to ensure that you're back on the mend, you're back to being healthy. So again, help us to help you.
Yes.
Take your medications in the way that it was intended, because it'll help us in the long run, all of us.
Now it's time for the segment for Ask Doc. This is the part of the show where people send in a few questions. First question is, why do I need to take some of my medication with food? It's hard for me to eat if I'm not hungry. Okay, so
yeah,
a twofold answer to that.
It's a twofold answer to that. There's, again, a few drugs that behave differently. I think we think, oh, it's just medication, but a lot of drugs behave a bit differently. Some of our like psych drugs, like the individuals that have mental health problems, it's important that they take a large meal with some of their medications, because it's going to help them to better absorb the medications. Some medications, if you take it on an empty stomach, it can actually cause upset stomach. Let's say I'll take a pain medication, like a lot of us know, Advil, that can actually irritate the lining of your stomach, your gastrointestinal tract. And then again, you end up in the ER.
Yep, a lot of times we get a lot of patients who end up in the ER who's been popping pills because they hurt their knee or twisted their ankle and not eating with it.
So, and once you take the food, it's going to help to protect that lining of your stomach. Like, it's very important for some of them. And we have some medications that we tell you, hey, well, you don't have to take this with food because it actually works better without food.
Yep.
So once you put it on the label, it's there for a reason. We really want the medication to work in the way that it was intended, in the way that it was produced to be effective in the body. So if it says take it with food, please take it with food.
So the other question is, I don't take my medication the same time every day. Is that bad?
It can be. Let's say it can be. Let's say antibiotics. Again, it could be a bit of a challenge. It might not work in the way that it is intended. You may have a situation with some medications that, you know, if it's a once daily drug, you took it, let's say at 10 a.m. the day before, and then you change it tomorrow to sometime closer, or like you took it at the nighttime and you wake up in the following day and you took it in the morning. These medications can overlap. And we don't want a situation, if you're diabetic, you're taking the medications the way that you're supposed to, technically, but you can end up with something called hypoglycemia, where your blood sugar drops because you have too much.
Taking it too close together.
Too close together. Again, we keep talking about
That
this
therapeutic
that
index,
therapeutic
it went up too high in that moment.
Yes, right. And so I keep saying you end up in the ER.
Yep.
So as much as possible, I mean, we kind of reasonable expectations. Sometimes you might have forgotten. Let's say you were supposed to take it at 8 a.m. You took it at 10 a.m. and your next dose is at 8 p.m. at night. That's okay.
Yeah.
I feel like that's okay. We usually like a nice range of about 1 to 2 hours, but sometimes not beyond that. So I mean, usually the saying goes, if you miss the dose, don't double up.
Right.
Just skip it, take
And
the
just
next,
keep going.
and take the next scheduled dose. And then obviously, if you come back to your pharmacist, like, hey, well, I have 1 or 2 tablets left behind because there was a few days during my treatment that I forgot to take it on time. We'd rather be safe than sorry. And then obviously the flip side of that is don't do that too often.
Yes, exactly.
So yeah, it depends, but as much as possible, try to stay towards the scheduled time.
All right. Well, thank you so much, Dr. Wintz, for being on the show. This was a really good conversation.
It was.
So that's it for this episode of Doc Says. I'm Dr. Gilma Bodley. Thanks so much for tuning in. And if you've got any questions you'd like us to answer in the future episodes, send us an email at publicrelations@bvihsa.bg with the subject line Ask Doc. We're here to support your health journey, one question at a time. Until next time, take care, stay well, and remember, only excellence counts.